Afternoon, Kath. Lovely to spend some time with you again. And we're going to be having a conversation about vaccinations and obviously within your area of expertise. So can you just introduce yourself, please?
So I'm Dr Catherine Monaghan. I'm a consultant in acute and respiratory medicine in North Tees and Hartlepool, in fact the University Hospital of Tees, but I'm also one of the medical directors in the ICB.
And as you know, we've been working together for 2 years, so
Yeah.
Alex Holloway, COVID-19 Programme Director. Fab. So the first thing I wanted to kind of just have a conversation about is the cold virus similar to the flu, similar to flu?
So, not really. There are some similarities, obviously, in that they're both viruses. The cold virus tends to be from a family of viruses called rhinovirus, and generally the symptoms do tend to be milder than flu. So I'll just talk about the cold, a common cold, first of all, commonly caused, like I say, by the rhinovirus. It can make you feel pretty unwell, so symptoms tend to come on over a couple of days. I would imagine that there would be nobody that hasn't had a cold. But just so we're clear, sore throat, runny nose, stuffy nose, headachy, just feeling quite generally unwell. But flu is really a different kettle of fish completely. It's caused by the flu virus, so flu A or flu B would be the ones that we would commonly see, and it can be much more serious. So you may still have some of the previous symptoms that I've described, but you're less likely to have a runny, stuffy nose. And I think the problem is overwhelming fatigue, so very, very tired, muscle aches, high temperatures, shivers, and really sometimes complete exhaustion to the point where you would really struggle to get up out of bed. So there is some similarities in that they're both viruses, but flu tends to be much more serious.
And I think actually it's a good point, because I know through the pandemic, obviously lots of hospitalisations with COVID, but actually we can still get hospitalised with flu because it is a serious virus, can't we?
Very, very much so. And it's something that we always worry about every winter. So every winter, we all see the pictures of the NHS under extreme pressure. We know about this and we plan for it. But one of the big pressures that puts the NHS under pressure really is around respiratory illness. That's what a lot of the winter pressures come from, and flu would be one of the common things that would cause us particular pressure, because it does make people unwell. Anybody can get flu, so it can affect anybody of any age, but some certain patient groups, which we can come on to, are much more likely to become unwell. You can become seriously unwell. You can end up in hospital. In the worst case scenario, you can actually die from flu. You cannot die from a common cold. You might feel really unwell, but it's not the same thing. Flu can be really serious and really dangerous.
I think that's a fascinating point, in that I know we see on the TV, on the radio, talking about NHS winter pressures. So actually, if you're a member of the public and you're eligible for the flu vaccine, you're actually doing your bit to help the NHS as well?
100%. So there's lots of things that people can do, I guess, to help themselves. The first thing I'd like to be really clear on is the NHS is here for you if you need us. So if you are worried and you are unwell, you must seek medical attention. But there are a lot of things you can do to help yourself. So the common cold, for example, drink plenty of fluid. Tea, coffee and alcohol do not count, I'm afraid. We mean plenty of clear fluids. You might not feel like eating, particularly if you've got a sore throat. That's okay. Little and often of what you fancy is absolutely fine, but keeping up your fluid is really important. Having a well-stocked medicine chest, I guess, as it used to be called, old-fashioned, but a well-stocked medicine cabinet.
In your bathroom?
Yeah, so paracetamol, ibuprofen, unless there's a reason that you can't take it. If you're unsure, please always check. Be careful of remedies like cold and flu remedies. A lot of them contain paracetamol, so anything that you take, check what it's got in it. You cannot, for example, take paracetamol and cold and flu remedies containing paracetamol. Make sure you're keeping yourself warm, and please call for medical attention if you're feeling really, really unwell, because we are here for you and we are here to support, and we're putting a lot of extra capacity, a lot of extra appointments into the system this winter to try to support people who are unwell with respiratory illnesses.
That kind of what it looks and feels like for us. But one thing that we can't do, obviously the NHS can, is look inside our lungs, and we've talked about that fatigue, sore throats, but what does flu do to people's lungs if you catch the virus?
So you can get what we call a viral pneumonitis from flu. So pneum means of the lung, and itis means inflammation. So you can get a viral pneumonitis, which causes an inflammation of your lungs. We can see it on a chest x-ray. We could see it if we did a CT scan. And that's quite difficult because there isn't really... You can give Tamiflu, so against the flu, but once you've got the inflammation in the lungs, that can take a while to settle down. I think one of the things that we would be more concerned about with flu is what we call a secondary pneumonia. Right. So pneumonia, again, pneum means of the lung, and pneumonia means an infection. So you've got flu, that dampens down your immune system and it makes you more susceptible to bacterial infections. So things like streptococcus or staphylococcus. So one of the things that would make people very unwell with flu is a secondary pneumonia. So you've got flu, but you've got a bacterial infection on top of it. So then we would give you Tamiflu for the flu, but then you would need intravenous antibiotics. Often, not always, but you would sometimes need intravenous antibiotics for that secondary pneumonia. So the way that I would explain it to patients, if you imagine your lungs are like a sponge and you should have air holes in them. When you've got pneumonia, you haven't got air in the holes of the sponge, you've got gunk, that's not the technical word, but you've got the bacteria, you've got the consequences of the body's response to the bacteria, so it's full of what we would call secretions, and then you would feel breathless because that part of the lung, the air spaces where air should be getting in and out, is full of this gunk, for want of a better word. So that's why you may feel very, very breathless. Your oxygen levels can drop. And sometimes we can't give you enough oxygen just using a face mask, an oxygen mask on your face or up your nose. So sometimes that's when we would need to take people to intensive care, put them asleep and put them on a ventilator so we can get enough oxygen in. And we can certainly see that with pneumonia, a secondary pneumonia, secondary to flu.
So actually having the vaccine, if you're eligible, protects you from all of that care that has to be delivered in a hospital setting for several days, weeks.
Absolutely. And hospitals are not nice places to be in. There's very few people that actually want to be in hospital. It's busy, it's noisy, people want to be in their own beds, in their own homes. But if you get a bad case of the flu, you need to be here. And the vaccine can help protect you. It reduces your risk of getting flu, and it also reduces the risk of you becoming really, really unwell with flu. And anybody who's ever been on intensive care, it's a very, very difficult place to be. It's not nice. You can be left with problems from being on intensive care. So anything that you can do to reduce your risk of firstly getting flu and secondly becoming really unwell with flu, I would very, very strongly advocate, and we know the vaccine does those things. So if people are eligible for the vaccine, please come forward. If you've got doubts or concerns or queries, then please speak to a healthcare professional who will be able to advise you appropriately for your individual circumstances.
I think that thing about eligibility, so there will be certain conditions that make you eligible, but age as well is obviously a factor, whether you're a young child all the way up to my dad who's age 76. Both are fit and healthy, but actually, does that matter in terms of your risk of getting flu vaccine? You're fit and healthy 76-year-old versus my niece who's 8 years old.
The recommendations for vaccines are obviously there for a reason, and what we do know that a fit and healthy 76-year-old, brilliant, but you would still be more at risk of becoming really unwell with the flu, and that's because, as with everything else, your immune system, along with your heart and your lungs, is 76 years old. So I guess if you think of it in terms of the lifespan of a washing machine, for example, things do wear out. They don't work as efficiently when they're older compared to when you're younger. That's very, very general and broad, but I think it's a good way of thinking about it. You are more at risk if you're older because your body and everything is older by very definition. And obviously, if you've got other health conditions, you are more at risk, not necessarily of getting the flu, but you're more at risk of becoming very, very unwell with the flu. which is why we look at people who have got what we call long-term conditions. So health conditions that they live with, we can't cure, we can't solve, but we manage them, we manage the symptoms. They're more at risk of becoming unwell with the flu, and the flu vaccine reduces the risk of that happening.
I absolutely love the analogy with a washing machine. I'm definitely going to take that. It's a very simple way to have a conversation with my dad about the importance of getting his flu and winter vaccinations.
You wouldn't expect a washing machine that's 6 months old to break down. You wouldn't be that surprised if a washing machine that was 10 years broke down. So you would do everything you can to keep up the maintenance of your 10-year-old washing machine.
100%. So I know it may sound very, for me, simple, but it's not simple for everybody. Obviously, the virus is transmitted through the air, they get into our lungs, but then how do they get into our body and then kind of cause those conditions that you've kind of described?
So respiratory viruses are commonly spread by droplet. So what that means is if I had the flu now, which I do not, I can promise you, and I coughed, I would commonly put my hands over my face and I would get the droplets of the flu virus in my hands, and then I might touch you or shake your hand, transfer the droplets over, and then they get into your body. Or I might touch the table and then they can be transmitted like that. So I think just to address that before I come on to your actual question, that's why we talk about catch it, bin it and wash your hands, because it is effective in reducing that transmission. So I've been on the ward this morning, I've washed my hands about 30, 40 times. I've washed my hands before I came in here. That's just good practice. If I had a tissue, I would bin it up and immediately put it in the bin. So the droplets then get into your airways, and it's not necessarily, this can be a bit complex, it's not necessarily the viruses or the bacteria themselves, it's our body's response to them. Right. So our body would recognise them as foreign, and it would mount what we would call an inflammatory response. So it's basically saying, there is an invader here, not keen on this, we need to get it out. And it would send a lot of cells that are designed to fight infection to the areas of the virus, and that's what causes a lot of the problems. So there's a whole different range of cells which I do not think people will be interested in, and if I'm truthful, the exact detail of which would not exactly be at the front of my memory, but a lot of it is the body's response to the virus, to basically, or a bacteria, although flu is a virus to be clear, but it's the body's response to it. So a lot of the gunk I talked about earlier, that's byproducts of cells called macrophages. They produce these chemicals to try to get rid of the infection, and that's a consequence of those cells coming in to defend the body.
And just kind of pulling together a couple of things that you've kind of told us about today, and I know that you're a specialist in respiratory medicine, and I think NHS uses terminology like people with comorbidities, making you more at risk to winter viruses in the round. But actually, what we quite simply mean is you may have multiple diagnosed diseases, and then from a respiratory perspective, that's why it's so important for those patients to be getting their flu vaccine as early as possible.
Absolutely. So there'll be certain conditions that I think, like you say, they would be probably quite obvious to us, but not necessarily obvious to everybody. So COPD, asthma, scarring on the lungs, interstitial lung disease, I would tend to think down that route because obviously I'm a respiratory clinician. But there's a list of conditions, like you say, and comorbidity. So morbidity just means something that makes you unwell. That's what morbid means, being unwell. Co means more than one. So if you've got lots of comorbidities or multiple health conditions, then you are much more at risk of becoming seriously unwell from flu, which is why we would recommend the vaccine. The criteria for vaccination are not random. They're based on basically people with real expertise in this area. They look at all the data and then they come up with decisions as to who would benefit the most from the vaccines. You might just say, well, why don't we vaccinate everybody? I think then you're moving more into the thoughts of health economics. It would be very expensive. It would be very, very difficult to deliver. So we target patients, we target the population who we know are most at risk of becoming seriously unwell, which is why we would urge anybody, if you are defined as being in an at-risk group, please come forward for your vaccine. If you're not sure, if you've got doubts, please speak to a healthcare professional who will be able to be sure that you really understand the risks versus benefits in your individual situation.
So just to unpack that a bit more, so actually, because over time we've seen the Joint Committee of Vaccinations and Immunisations adjust the cohorts for COVID, for example. Sometimes they've been the same for flu, but actually as we go into this autumn, winter, they are different. But that's a good thing, because that's the success of the COVID vaccination programme, and that's why there's the difference.
Yes, yeah, it's at least partly a big part the success of the COVID vaccination programme, but the viruses, and this is part of the problem in health, they're always slightly one step ahead of us. And so the flu vaccination, the exact specific flu vaccination is based on what we know from last winter. Unfortunately, we cannot yet predict the future. So we do
You're good, but not that
We're
good.
good, but not that good. So we do not know what flu is going to look like this season, and we have to be transparent about that. The flu vaccination is based on what we saw from last winter, and it's based on the best evidence. And I use the word evidence, it is not a guess, it is not random, it's based on evidence of scientists and clinicians who know what they're doing, and they will model the flu vaccine based on what happened last winter. And then the recommendations for who should get the vaccine are tailored upon information. The viruses will always try and get one step ahead of us, and I'm sure you remember during the pandemic where they did that, and every time we thought, okay, we're all right now, then a new variant would come out. And that's the challenge that we're always trying to keep up.
Just to kind of bring this then to the next set of questions, I think just those really small changes in how the virus or a virus is structured is what can then cause like a real shift in terms of how widely it can spread, could have more severe conditions as a result of it. But as you say, it is based on trusted individuals taking an absolutely clinical approach to the available evidence at the time.
Yeah, absolutely. There is no guess around it at all. And you will definitely hear of some years where the flu vaccine has probably been less effective. But there are years where the flu vaccine is highly effective, and that's because it's based on what happened last winter, because that's all we've got to go on. I would not take the chance of assuming that the flu vaccine is going to be less effective. I'd never ever not get my flu vaccine. I've had flu once and I never ever want to have it again. It was horrible, really horrible.
I think I heard from someone else that you've got flu if there's a £50 note in the garden and you can't get out of bed to go pick it up.
Yeah, if you had a cold, I think you'd be all right. I think you'd go and get the 50 quid. If you had flu, you wouldn't physically be able to It's really, they are very, very different. Hence, I guess, this podcast, really.
Kath, one thing I wanted to, that people probably don't see the severity of, but people who are admitted to hospital who have got flu, what does it look like? Could you describe to me what that patient is having in terms of their treatment, what the symptoms they could be doing, and actually demonstrate the real severity of the flu virus and why it's so important to get the vaccine?
Yeah, so there would commonly be in a side room. That's the first thing. Flu's transmissible, and we would not want to put a patient with flu in a room with people who did not have flu. Sometimes, depending on the pressures, we can't always cohort as well as so that's what we call it, cohort. We can't always manage to do that, but we would always try very, very, very hard to do that. They generally feel really unwell. They look unwell, so sometimes the heart rate is high and the blood pressure can be low. That's a sign of a body's response, a stress response to infection. They may have a high temperature, or we can see temperatures that swing up and down. If they've got a pneumonitis, which we talked about earlier, the inflammation of the lungs, we may sometimes hear some crackles on the chest. Or if they've got a secondary pneumonia, then you would definitely expect to hear crackles or air not moving in and out of one side of the lung as we would normally expect. Oxygen levels may be low. So we would treat that according to which one of those problems a patient had. So oxygen levels, we would give oxygen. That can be a bit difficult in some patients. So without going into too much detail, some patients, particularly with COPD, you can give them too much oxygen. So too much oxygen can be dangerous. So you've got to manage the oxygen very carefully. And sometimes, if you've got a bad pneumonia or a bad pneumonitis, we can't give enough via a face mask. So we have to use different forms of what we call ventilation, which is a way of getting oxygen into the lungs. Sometimes we can do that through putting what we call high flow nasal oxygen, so lots of oxygen going up through prongs in the nose, or sometimes we need to put people to sleep on a ventilator to get enough oxygen in. The blood pressure and the heart rate we would normally manage with fluids in through a drip. We would give Tamiflu in this situation, and if people had a secondary pneumonia, if they were as unwell as I'm describing, we would normally give intravenous antibiotics as well. So 3 or sometimes 4 times a day, depending on the antibiotic that we would be using. I would normally say to people, it will take you weeks to feel completely better from flu, and if you've had a secondary pneumonia, then it will take you weeks and weeks to feel completely back to normal. It will wipe you out, so you will be lethargic, you'll be tired, you'll struggle to do, I guess, your normal day-to-day stuff for sometimes for weeks afterwards, and that's even if you're young, fit and otherwise healthy. If you've got the comorbidities or the multiple health problems we talked about earlier, that can take a lot longer. And sometimes, really sadly, we do see people die from flu. Heart rate high, blood pressure low, can't get the oxygen up sufficiently, and people, unfortunately, sometimes do die, which is absolutely clearly not what we would want.
And I think understanding that risk, I think, is just really important. But I think communicating that in a really simple way, which you have done through the course of this podcast, I think allows people really just to kind of actually tap into this and understand it.
Yeah, I mean, we don't want to spread fear. We don't want to fearmonger around this at all. But what we do, I think I do want, is for people to understand how serious flu can be, to be ensured that you're fully aware of that when you make a decision as to whether or not you're going to get a flu vaccine when you're offered it. It's not a cold, it's different. It can make you very unwell. Often it doesn't, but it's not a chance I would take.
No.
Personally, it really isn't. And even if it doesn't make you as unwell as we've described to bring you into hospital, it can spoil your Christmas. You know, who wants to spend Christmas Day, Boxing Day, Christmas Eve in bed with the flu? Nobody. So again, that's why, like I say, we would really urge people to get the vaccine when offered.
And actually, getting the vaccine when the campaign opens at the start of October means you can then park it, you're protected, and then actually you've got Christmas to look forward to and all that shopping.
Yeah, I'm not. I think my husband would probably like to do anything to get out of the shopping. But yeah, absolutely. People are busy. You want to be busy having fun, not busy in bed with flu. And I think the other thing I'd just like to add at this point is you cannot get flu from the flu vaccine. So that's a bit of a misconception. It's technically impossible. The flu is not a live vaccine. It's a dead vaccine. So that means it's modelled on the virus, but it's not an active virus. So it's absolutely impossible. You would commonly hear people say, oh, I got the flu after the vaccine. If you did, and if it was genuinely flu, it is not related to the vaccine. You would have been getting flu anyway. And it's more likely, although I cannot say for certain, it's more likely that actually you had a cold and that you would get them at that time of year anyway, because viruses love the cold and damp. That's why we see more of them in the winter. A good old-fashioned British winter, it's cold, it's damp, and that makes viruses thrive, and that's why you're more likely to get them in the winter, because they just love those cold, damp conditions.
And of course, weather's colder, raining more, so actually you're naturally more inside at home.
Yeah, absolutely,
And then just final thing to talk on, because obviously as we speak now, the school-aged immunisation service is rolling out and delivering flu to school-aged children based on their eligibility. You know, I know you're a parent. You know, what would you be saying to kind of those mums, dads out there that have their children, they're in school, about the importance of getting that vaccine?
Oh, it's really important. As one of my colleagues, Dr Catherine Smith, describes, children are little plague rats. Massive apologies to anybody who's offended by that. But children are carriers of viruses because of all the things we've described that you do if you've got a cold. Children at that age, at that young age, they're not necessarily going to cough it bin it and wash their hands. They're going to be coughing and sneezing all over each other, all over the parents, all over the grandparents. So they can carry the flu virus and they can pass it on to parents, grandparents who may be vulnerable, who may have decided for whatever reason not to get the flu vaccine, and that's how it can spread quite quickly. So I think that's at least part of the logic in vaccinating children, to protect them, obviously, but to protect the other people around them and other family members. So yeah, I think it's really, really important. And if I haven't persuaded you so far, if your child's got flu, they can't go to nursery or school. So that does have childcare implications for people. If I haven't persuaded you from the healthcare of them as an individual, of the family and of the broader community, then just think about them having to be off with for childcare purposes, and that's a big challenge for working parents.
Absolutely. Kath, I just want to thank you for taking time out of your day. I know you've got to go back onto the ward shortly, but just thank you so much for allowing me to have a conversation with you and tap into your expertise.
No
Thank
problem.
you.